I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mr. Ramzan. May I know what brings you here today? Diabetic, uncontrolled. Okay, ulcer on the foot here. I'm really sorry to hear about it, Mr. Ramzan. I understand it must be very stressful for you. But I appreciate that you are concerned about your health. So, Mr. Ramzan, in order to understand your condition, I would ask you a few questions. Is it okay with you? Mr. Ramzan, can you tell me since when you are having this ulcer on foot? 3 weeks. How it started? If any wound appear? Okay. So, which medicine you are taking for your diabetes? Insulin or tablet? Okay. Do you know your current HbA1c level? Right. Okay. Okay. If there is any associated symptoms like do you have any fever, neck pain, headache? Okay. Any discharge from ulcer? If you had bandage or treatment for ulcer? Okay. Which type of shoes you we are mostly like to wear? Okay, Mr. Ramzan, if it is painful or painless? If you had any previous healed ulcer? Okay. Is there any wound in your body? Any ulcer? Okay. Okay, Mr. Ramzan, if you are taking any medication prescribed by doctor or over the counter or any painkiller? Okay. If you have high blood pressure? Okay. Is there any major medical problem running in a family like high blood sugar or high blood pressure or any heart problem? Okay. Okay, Mr. Ramzan. I'll ask you a few personal questions. Is it okay with you? Do you smoke? Do you drink? Okay. What is nature of your job? Okay. Thank you, Mr. Ramzan. So let me summarize that he told me that your sugar is uncontrolled and you are having foot ulcer since 3 weeks and you are a chain smoker. Is there anything else you like to add? No? Okay, Mr. Ramzan, in order to understand your problem, I need to examine you. Is it okay with you? Thank you, Mr. Ramzan, for following. And kindly move on to the couch and expose your foot and leg up to the shin. Yeah, both. Okay. Then I'll sanitize my hands and let them dry and will rub my hands. And then I'll look, feel and move. Then I'll start from look. I'll check both foot from shin to fingers, color, pallor, red, and swelling. I'll observe the tip of the toes, look in between the toes, look at the dorsum of the feet, look for the presence of hair on dorsal side of feet and on shins, and I'll look for if there is any dry skin or any fissures or crackles. Look for deformities like claw feet, hallux flexus, hammer toe, flat feet and pes cavus, and look at the medial border and look at the lateral border. I'll feel back of heel by raising to see any heel pressure, and then I'll observe nail and look at the sole of the feet, and then I'll start to feel, and then so I will I will feel bony prominences, feel for the temperature of the foot on the dorsum of the foot and the shin, and using back of my hand and comparing both sides at the same time. Then I'll look at dorsum of the feet and palpate for foot arteries, and I'll check dorsal pedis arteries and lateral to external hallucis longus and posterior tibial arteries, posterior inferior to medial malleolus, and I'll feel peripheral pulses. and then I'll check vibration sense with 128 Hz a turning fork placed over bony areas of the big toe, and I'll ask if he feels vibration and when it is stopped, and then I'll check for the ankle jerk, and then I'll come to the move. I'll hold the big toe between the thumb and index finger from side, separate a big toe from the other four toes, and then I'll ask patient to close his eyes and ask him let me know which side of foot, which side of big toe I am moving and on which direction, to check the proprioception. And then I'll use cotton wisp and touch to the tip of toes and ask patient right or left foot you are touching, like I am touching. Right foot, left foot you are feeling I'm touching with cotton. And then I'll use pin for pen. So before I use pin for a pen, I'll let a patient know. I'll give him example how it will feel on patient's arm first, and then I'll use pin on his foot, and then I'll use monofilament for pressure sense. I'll touch 9 areas of the foot and will press monofilament till it is bent, and then I'll come to the management. So thank you, Mr. Ramzan, for your cooperation. You can have your seat. Yes, Mr. Ramzan, there is a small ulcer on your foot. You might be perceiving it as a minor problem, but mind it, God forbid, if it is not taken good care of at this point, it can lead to series of events which end with black dead foot, which may need amputation. Okay, in order to save your foot, you must control your sugar level in the first place, and then observe few do and don'ts, and be aware of some danger signs. Okay, do you understand? Is everything clear till now? Can I repeat it again for you? Okay, so first we'll start from what you should do. Okay, and get your feet checked periodically by a doctor. Okay, use mirror to check under a surface of your feet daily. If you have any problem with mobility or vision, check with the help of someone at your home. Okay, and look for cuts and bruises and color of his skin. If you notice any swelling, growing at toe, nail, or open sores, okay, then let me know. And wash your feet daily with soap and water. No need for any fancy disinfectant. Okay, wash in between and toes as well. Dry your feet carefully after washing, especially in between the toes. Okay, and keep your skin soft by using a moisturizing lotion. Okay, and cut toenails straight and file the sharp ends. Check your shoes for stones and pebbles before wearing, and wear cotton socks and should be well fitting. Okay, but no tight elastic. And come to the don'ts. So don't let your feet dry. Don't walk bare, especially in the sun and sand. Please don't smoke. Okay, try to quit smoking completely. Okay, because it will slow down your progression if you quit. Okay. And don't use common medicine or sharp badges if you have colors. Okay, and there is safety netting. Okay, in the if you in the end a few danger signs for which you must consult your doctor immediately. If you see your foot become noticeably red or become painful, tender, or whole or part of foot become hotter than usual, if there is any open sore or blister, if any discharge, pus or blood, or smell bad. Okay, and if you feel unwell, fever, nausea, vomiting. Okay, is it clear? Okay, so Mr. Ramzan, your feet, shows loss of sensory feeling, and I could not feel your feet pulses as well. So I think you are suffering from what we call in a medical term is neurovascular plantar ulcer foot, okay, which is painless. And I would like to examine your feet every 3 months from now onwards. Okay, and yeah, but you need to control blood sugar in the first place. And as you told me that you are hypertensive, and you are taking beta blockers, so I'm going to stop beta blocker right now, okay? Because it will, worsen your ulcer. And can you manage it? Okay, Mr. Ramzan, if you develop any new symptoms or problem with your feet, please do not hesitate to contact me immediately. Okay, we may need a multidisciplinary teamwork to take care of your feet. Okay, is everything clear to you? Can I repeat it again for you? No? Okay, Mr. Abdullah, is there anything else you would like to discuss with me today? Okay, thank you for your cooperation. I wish you a speedy recovery. Okay, bye-bye.